If we're asking whether AI should take the lead in primary care diagnostics, the central question is this: does it actually work better than human clinicians? What does the evidence say, and what does experience in real-world settings reveal? Let's begin with a core question for both speakers. Can AI tools outperform general practitioners in diagnosing undifferentiated, real-world primary care presentations?
Thanks, Dr. Sage. This question cuts to the heart of the debate, and the answer is, in many cases, yes. We now have strong comparative studies showing that AI, especially large language models and deep learning algorithms, can match or outperform primary care physicians in diagnostic accuracy, particularly for single-system complaints. A 2020 study in The Lancet Digital Health compared an AI-powered triage system to physicians across 100 clinical vignettes. The AI was more accurate than 70% of the physicians, and that was 5 years ago, before GPT models were even part of clinical workflows. In dermatology, algorithms trained on image databases like HAM 10,000 are now classifying melanoma with accuracy comparable to dermatologists. Ophthalmologic AI platforms, approved by the FDA, can independently screen for diabetic retinopathy with no human input. And let's not forget scale. A single AI system can analyze thousands of cases per hour. Humans can't. That scale becomes critical when you're trying to triage thousands of patients in a health system under pressure. In fact, I'd argue that not using AI now borders on negligence in certain situations.
Thank you, Dr. Malhotra. Dr. Hawthorne, your response.
Well, Raj certainly paints an optimistic picture, but I'd caution everyone listening not to confuse controlled studies with messy real-world medicine. Most AI diagnostic tools are validated in ideal conditions: clean data, clear symptoms, curated inputs. But real patients, they show up with half-finished sentences, vague complaints, overlapping systems, and emotional overlays. The data isn't just blood pressure and lab results. It's context, nonverbal cues, hesitation, and even what's not said. And that Lancet study, the vignettes used were static. But in practice, clinicians ask follow-up questions, probe inconsistencies, pick up on the patient who says, "I'm fine," while avoiding eye contact. AI doesn't pick up on subtext. As for those imaging studies, yes, AI is great at pattern recognition. But diagnostic medicine isn't always pattern-based. It's about differential diagnosis, weighing probabilities, and sometimes taking a leap based on gut